Hi everyone, my name is Joshua Leto, and I'm really excited to teach you this course called Vaccine Science and Communication. I'll have my video on right now, but in the future lectures, I won't have my camera on because I want to make sure we focus on the content as well as prevent any connection issues in the future. This is going to be a short recording, but we'll first cover some basic information about the course and why we developed it. Then I'll introduce you to who we are and why we are fundamentally qualified to teach you this course. I'll then go over some important information about the course syllabus. And lastly, I'd like to provide you all with a framework for thinking about vaccines as we progress through each lecture this semester. The goal of this course is to teach you all about the science of how vaccines work. So when you're out in the field as a licensed intern and pharmacist, you're able to talk about vaccines confidently. You're able and equipped to answer difficult vaccine-related questions. And most importantly, you're able to dispel myths about vaccines. This course is essentially a continuation from the knowledge and information you learn from immunology and pathophysiology, as well as the information you learn from the APHA certificate program. The reason why we developed this course is because during the COVID-19 pandemic, our healthcare system heavily relied on pharmacists and pharmacies to administer vaccines. Our profession stepped up to the table, and we need to continue to grow this aspect of our training. That's why we want our students to be prepared for these demands and challenges. And our goal is to educate you all on how to communicate about vaccines to your patients. By the end of this course, you should be able to communicate to patients like the example I provide here. Vaccines provide information your body needs to recognize a specific pathogen. So when the real pathogen tries to infect you, your body is primed and ready to fight. So who are we and why are we qualified to teach you this course? First up, Dr. Seed. Dr. Seed is professor and chair of pharmacy practice for Worcester Manchester School of Pharmacy. She received her bachelor's from MCPHS University, an MP, her master's in public health from UMass Amherst, and her PharmD from Idaho State University. Dr. Seed has been a pharmacist for years and has been in the vaccine field for a while. She runs the travel vaccine clinic at St. Vincent Hospital, where she sees patients regularly and vaccinates them before they travel. As you're probably all familiar with, she helps coordinate and leads the APHA immunization training program, which everyone by this point should have completed. As of this recording, Dr. Seed is the MCPHS COVID-19 coordinator for the entire university. She works with the COVID-19 team in the Broad Institute to identify COVID-19 cases on campus and to initiate contact tracing and isolation protocols that she actually helped develop. Otherwise, some general information about Dr. Seed. She's actually born in Ireland and spent most of her life here in Worcester. She continues to give back to her community by actively volunteering with the UMass Medical Center and other local clinics to administer COVID-19 vaccines. And then you have me, Joshua Leto. I go by Josh. I'm born and raised in Bristol, Rhode Island, and I moved up to Worcester for school here at MCPHS. I'll be responsible for developing all of the lectures and for teaching the course. Dr. Seed and I are fundamentally both public health experts. I'll include some more information about me in the next few slides. I started my career in training at a small university called Roger Williams University, which was actually 5 minutes away from where I lived. I double majored in biology and chemistry and worked as a microbiology research assistant for 4 years. I worked on a parasite called E. histolytica, which causes the disease amoebiasis in humans. After graduating from Roger Williams University, I was really fortunate to spend the latter part of my career at Johns Hopkins Bloomberg School of Public Health. I received my master's in molecular microbiology and immunology, otherwise known as MMI, from Bloomberg School of Public Health. And this is actually where I developed my passion for vaccines. I completed a vaccine science and policy certificate from Hopkins and fortunately was taught by some of the smartest people in the world. This led me to work on a parasite called T. brucei, which causes the disease human African trypanosomiasis, otherwise known as African sleeping sickness in humans. I ended up developing my thesis titled Immune Evasion Mechanisms of African Trypanosomes, Implications for Vaccine Development. So as you can see, I'm a vaccine guy. After graduating from Hopkins, I worked as a protein biochemistry and crystallization associate at GSK in Rockville, Maryland. This was actually my dream job. I was creating and characterizing vaccines. As you notice, these slides look a little different because I can't change these slides without prior approval from my old job. I worked on characterizing 2 vaccine antigens against RSV and CMV. RSV stands for respiratory syncytial virus, and CMV stands for cytomegalovirus. My job was to crystallize and epitope map various sites on these antigens you see here with actual antibodies obtained from infected humans to essentially design more effective vaccines. We'll talk more about these viruses in the future in the upcoming lecture. Unfortunately, I actually hated this job. I was basically a lab rat at GSK. I quit my job and took a couple of months to figure out who I was. And during that time, I really came to realize that my passion was actually to educate people about vaccines and to administer them. And that's what led me here to MCPHS. And so I just provided this diagram right here where most people think success is this like linear slope, but in reality, it's not. It's a jumbled up mess, as you can see on the right. During my gap year, I was a lab manager and research assistant at Brown University. At Brown, I also developed a course, a lab-based course for STEM students called Unravel the Mysteries of Human Diseases in a Worm, and that worm is C. elegans. This was my first exposure to course development and teaching. And now we're here today where I'm actually a P3 API student developing this course during one of my rotations. As a student, I've been really involved in public health work. I volunteer with the UMass Medical Center as a COVID-19 swabber. I volunteered with multiple pharmacies, including Walgreens, Shaw's, and Hannaford, to vaccinate hundreds of people with all 3 coronavirus vaccines. I became a vaccine educator at the Edward M. Kennedy Health Center in Worcester, Mass. And I also volunteer a lot with a nonprofit organization called FIMRIC. Last spring in 2020, I actually traveled to the Amazon rainforest in Peru, where I worked with the indigenous population there in medical clinics that the organization set up, which was a really amazing experience. With all of that, let's dive into the syllabus. If at any point you guys have any questions, please feel free to email us. Our email information is on the syllabus. I won't go over every detail, but the schedule for all the lectures is listed on the syllabus. It is your responsibility to read the entire syllabus, but I just want to highlight a few important things in the next few slides. So quizzes. There will be 15 Blackboard quizzes. Each consists of 10 questions each. They're open book, and there'll be a max of 3 attempts. Each attempt, there's a limited time. Your highest score will count as your final grade, and all the quizzes will be open at the beginning of the semester and will end on the last day of the semester. Unfortunately, there'll be no makeups allowed because you basically have enough time throughout the whole semester to complete all the quizzes. Another important aspect of the syllabus is the research project. The goal of the research project is to utilize everything you learn throughout the semester to design and recommend your own investigational vaccine against a pathogen of your choice. We're not asking for much, only a 2 to 5 page paper. The vaccine you recommend must be used for prevention or treatment of a pathogen that does not have a current vaccine on the market. You're required to use literature to support your recommendation for a specific vaccine platform of your choice. You can find more information about the research paper on Blackboard. Please read the research rubric. Actually laid out everything you need to know and give you an example of what your research paper should look like. Again, if you have any questions, please don't hesitate to email us. Here's just a breakdown of the course grading. The goal for everyone is essentially to get an A in the course. As long as you do well in your quizzes, and again, remember, they're open book and unlimited time, and you do have 3 attempts. And as long as you do a good job in your research paper, you're golden. Lastly, I would like to just provide you all with a framework for thinking about vaccines. Throughout the semester, after watching each lecture, I want you to know some basic information about the disease we discuss, and that includes some clinical symptoms about the disease, the mode of transmission, the burden of epidemiology, and then most importantly, the vaccines themselves. So I want you to know the types of vaccines that's used for the disease or the specific pathogen, the correlates of protection, the routes of administration, some indications and contraindications for vaccines, the vaccine schedule, some safety and efficacy information, and any counseling points I provide you. What's really important actually for your NAPLAX is understanding the route of administration, as well as the vaccine schedule for many of the vaccines. So taking this course is really going to help you in the long term, not only on your NAPLAX, but also when you are a licensed pharmacist in the field. And with that, that concludes this introductory lecture. If you have any questions, of course, don't hesitate to email us. We're happy to help in any way possible. Have a great day. Thank you.